It is alarming. Dr. Dorothy Fink, an endocrinologist at NYU's Langdon Medical Center, joins us now. Are these numbers surprising to you?
Honestly, no. Every day in my practice, I see patients with all sorts of endocrine problems, and all the time I say, oh my goodness, your hemoglobin A1C is elevated too. You have diabetes or pre-diabetes.
But from 100 million to almost, what, 500 million?
Right.
What's behind the surge?
You know, I really would say that many things cause it, but the truth is our world in the past couple decades has become really more sedentary, and we eat processed food all the time. And it has led to our pancreases just working harder and harder and harder, and they're running out of steam.
Wow, and not only is this a potentially deadly disease, it also increases your chances at having other health risks as well. Can you explain?
It does, definitely. Well, just as the gentleman said in the segment, diabetes is silent. So for many years, people don't even know their blood sugars are elevated. And then it can affect your eyes, your heart, your feet, just about every organ in your body. So the point we want to focus on is prevention, and really focus to taking the time to exercise and think of food and exercise as medicine.
But is it as simple as going to the doctor and getting checked out? I get an annual physical every year,
Right.
But how can I tell if I have diabetes if the doctor doesn't know to look at it, or does he check everything with the blood?
That's a great question. Usually we have to think about your family history and other risk factors, especially for young people. But now even children are getting diagnosed with diabetes, so we really need to make sure that we think about that when you're going to see your doctor, and also making sure that you think about your family history, whether it's your parents have diabetes, or you have a family member, or yourself has gestational diabetes, which is diabetes in pregnancy. Those are all factors that can factor into knowing your risk.
And I was just about to talk about that. I love sugar. I think all Americans love sugar, whatever.
It's
but
true.
A lot of times we make comments with our friends, oh man, if you keep eating those cupcakes, you're going to end up with diabetes. How much of your diet really does play a role, or is it genetic?
It's a good question, and the genetics does play a role, but the truth is you can make a huge difference with the food that you take in on a daily basis and the amount of activity you do. So I have patients all the time where I had a gentleman last year, his A1C was 8.8, and he had bagels every day on his way to work, which is like a New York staple, and he had sugary drinks all day with coffee, and he cut those out, and his A1C is now in the pre-diabetes range, and he went from obesity to a normal BMI. So it's possible to reverse it. We just need to motivate people and know that it is possible to do it naturally.
All right, final question. Most of these cases are type 2. What's the number one thing we need to do to bring those numbers down? That's a lot of people worldwide.
Right. Well, I definitely say I love taking a natural approach to all of this, and it's truthfully just thinking in your term of your day-to-day family life and saying, how can I really take time out for myself to exercise for 60 minutes a day, and say how many less meals in a given week can you eat that are not processed and are not takeout. And I think that could make a huge difference for everyone, because it's not just about medicines. We'd rather help people before the medications have to come on board.
But you can still have a little fun. One cupcake a week.
Definitely. Well, you know, there's many ways to have fun with food, and I think that learning ways to go about working with foods in their natural form, not in a processed form, you can still have it and on holidays and things, but I would limit the cupcakes. Not every day.
Speed dial. All right, thank you very much. Always good to see you, Doc.
Nice to talk to you.
All right.